It's that time of the year when the days get shorter and many of us struggle with winter blues and seasonal affective disorder. Today we'll take a look at the difference between winter blues and seasonal affective disorder and what you can do about it. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. Winter blues are something that many of us may experience during the winter months. It's characterized by feeling a little bit more gloomy, a little bit more down. You might notice your brain is slowed down a little bit. You might have less motivation. You might want to sleep more or not feel like socializing as much. And winter is a time to slow down, so this might not be problematic. However, seasonal affective disorder can be quite serious. Seasonal affective disorder affects people's work and relationships and overall functioning in a much more significant way than winter blues. The hallmarks of seasonal affective disorder are hypersomnia, so sleeping on average an hour more than you would in the summer months, increased appetite and craving for carbohydrates, along with weight gain. And this can be a weight gain of 3 to 4 kilograms or about 6 to 8 or 9 pounds. Symptoms include depressed mood, loss of pleasure or interest in things, fatigue and low energy, problems with concentration, either feeling agitated or slowed down like you're moving through molasses, and then more serious symptoms like feeling worthless, feeling guilty, or having suicidal thoughts or thoughts of self-harm. If you feel that you may have seasonal affective disorder, don't hesitate to reach out either to your primary care physician or a psychiatrist or a psychologist. There are 3 main theories that explain why seasonal affective disorder and winter blues may occur. One of these theories is called the Photoperiod hypothesis. It's thought that the shorter days predisposes to winter depression in vulnerable individuals, and it's thought that this is actually secondary to secretion of melatonin. Melatonin is secreted by our brain during a period of darkness. So in the winter months, when the days are shorter and there's more darkness, our secretion of melatonin happens over a longer period of time. And it's thought that the increased duration of secretion of melatonin is associated with depression. One study found that people with seasonal affective disorder had a longer secretion of melatonin in the winter versus what they would have in the summer months. And they compared this to people who didn't have seasonal affective disorder. And in those patients, they found that their melatonin secretion, the duration of secretion, was similar in the winter and in the summer months. The second theory is called the phase shift hypothesis, and this refers to a body clock or circadian rhythm that is misaligned with natural day and night cues. The phase shift hypothesis refers to the idea that there's an optimal relationship between the timing of the circadian rhythm, which involves a reduction in core body temperature and secretion of melatonin, and the timing of sleep. So when these things are not lined up, it's thought that it can contribute to seasonal affective disorder. And the third theory is that the body changes its way of using serotonin in the winter months. And there's an uptick or an increase in the activity of the serotonin transporter, which basically moves serotonin in the synapse, which is the space between the neurons. So the synapse is that little space. There was a study that showed that people with seasonal affective disorder had higher activity in the serotonin transporter compared to people who didn't have seasonal affective disorder, and that the activity of the serotonin transporter actually normalized with exposure to bright light therapy and also normalized in the summer months. What are some ways to reduce the symptoms of winter blues and seasonal affective disorder? Morning bright light therapy is very effective. Using a light box for about 20 to 30 minutes in the morning can be quite effective and can improve symptoms within 1 to 4 weeks. You want to use a light box that's about 10,000 lux. The light should be placed about 2 feet away from you. It's ideal if the light is placed slightly above you. You don't look into the box, just like you don't look into the sun, so you don't want to be looking directly into that bright light, but you have it facing you so that your face is bathed in the light and the light reaches your retina at the back of your eye in order to work. Light therapy is especially helpful for people who oversleep and also for people who tend to overeat and crave carbs in the winter. There's no UV radiation given off from a good quality light box, so therefore you're not getting vitamin D from the light box. You're just getting a dose of bright white light. It's ideal if the light box is white light, and that helps to suppress melatonin production and to help regulate your sleep-wake cycles. Sunlight, natural light, is also a great way to get a dose of light. When it's sunny outside, we're getting about 50,000 to 100,000 lux, LUX, which is the light intensity, compared to a light box, which is usually around 10,000 lux or less, depending on which one you get. Aerobic exercise is also a great way to treat seasonal depression, winter blues, and is also great, of course, for physical health and non-seasonal depression as well. well. There was a study that compared aerobic exercise with stretching and relaxation. So they did aerobic exercise for 45 minutes twice a week in bright light, compared that to stretching and relaxation for 45 minutes in bright light, and they found that there were lower rates of depression, better improvements in symptoms of seasonal affective disorder with the group that did the aerobic exercise. You can also think about doing fun activities in the winter. I love ice skating in the winter, especially outside, even though I'm terrible at it. I really enjoy it. Or you could think about doing some snowshoeing or skiing or sledding or some sort of winter activity where you're active, you're moving, and you're also getting a dose of light. Ask your doctor about vitamin D. Many people with seasonal affective disorder have low levels of vitamin D. It may be helpful to take vitamin D preemptively before the darkness of the winter months sets in. It is possible to take too much though, so check with your healthcare practitioner about the right dose for you. Remember that winter is a time to slow down. This is when animals go into hibernation. It's a time for our metabolism to slow down, for our lives to get a little bit slower. We live in a society where we're always on the go and rushing around and trying to be productive. This is an optimal time to just take a break, take some time to reflect, tune in and listen to your body. And think about warmth. Warmth in the sense of warm foods, so soups and stews and things that are really hearty and nourishing. Warmth in terms of your home, so making your home cozy and inviting with beautiful candles and blankets, anything that will make you feel like your home is cozy and warm and inviting, maybe some little twinkle lights or something like that to make it a little bit festive as well. Make it a place that you really love to be. You can also think about warmth in terms of warm showers, taking warm baths. Baths with Epsom salts can be very relaxing, really good for calming the mind, relaxing the muscles, and helping with sleep. And also warmth in relationships, fostering connection, spending time with family and friends if you can, and if not in person, still maintaining those connections in other ways. If you found this video helpful, click the like button and subscribe to my channel. You can also sign up for my weekly newsletter with quick, simple, bite-sized tips on well-being. You can get the newsletter at intrabalance.com/newsletter. The link is also available in the video description.